Imagine waking up one day and not being able to remember your grandchild's name or losing your train of thought in the middle of a conversation. It's not a nightmare, but a growing reality for millions of people. What if I told you the cause isn't aging, but something in your medicine cabinet or your daily habits? Subscribe with peace of mind. We will accompany you with clear and useful tips to improve your well-being every day. By the end of this video, approximately 20 seniors will be diagnosed with dementia. That's 1 every 66 seconds. A chilling statistic that forces us to ask ourselves, are we really doing everything we can to protect our minds? The answer, sadly, is often no. 99% of the public is unaware of the risk that some common factors can reduce the brain's memory centers by over 28% in less than a year. We're not talking about rare diseases or unfortunate coincidences, but elements present in everyday life, often considered harmless or even beneficial. A groundbreaking study published in the prestigious Journal of Neurocognitive Health revealed that a specific class of medications and habits increases the risk of cognitive decline by 49% within just 2 years of regular use. This isn't just aging, it's preventable acceleration. Today, I'll reveal the 9 most dangerous factors ranked from least obvious to most destructive. Prepare to discover uncomfortable but crucial truths for your brain health. Knowledge is the first step towards prevention and protection. As you prepare to uncover these crucial factors, we invite you to reflect. What medications are you taking on a daily basis? Have you ever experienced that annoying brain fog or sudden forgetfulness that makes you doubt your memory? Share your experiences in the comments below. Your testimony will not only help us better understand the impact of these factors, but it could also be helpful to others in the same situation. Together, we can build a more aware and informed community. It's time to unveil the ranking that could change the way you view your health and habits. Each point is supported by research and offers concrete alternatives. Remember, your health is in your hands. Many turn to over-the-counter medications for restful sleep, but few understand the toll they take on the mind. Diphenhydramine, often found in products like Benadryl or some sleep aids, is a prime example. It is widely used for allergies and occasional insomnia. Its mechanism of action is insidious. It acts as a powerful anticholinergic. This means it blocks acetylcholine, a neurotransmitter essential for memory, learning, and general cognitive function. The hippocampus, the brain region crucial for the formation of new memories, is particularly vulnerable to this disruption. According to a study published in the Journal of Geriatric Cognitive Health, regular diphenhydramine users had a 54% higher risk of dementia than non-users. This risk occurred even with doses considered safe or occasional. Warning symptoms can be subtle and easily mistaken for normal aging. Confusion, difficulty finding words, misplacing objects, or a general feeling of mental fog are warning signs. Many attribute these episodes to aging, ignoring the true cause. Fortunately, there are safer alternatives. For allergies, drugs like loratadine or cetirizine have no significant anticholinergic effects. For insomnia, cognitive behavioral therapy, CBTI, or supplements like melatonin under medical supervision can be effective without compromising brain function. Crucial warning: never stop taking any prescribed medication abruptly without consulting your doctor. This is general advice and does not replace medical advice. Tricyclic antidepressants, such as amitriptyline, have been a mainstay in the treatment of depression and some forms of chronic pain for years. While effective for many, their side effects on the brain are a growing concern. These drugs also have significant anticholinergic activity, similar to diphenhydramine, but often more potent and prolonged. They block acetylcholine receptors, interfering with neuronal communication essential for memory and information processing. Research published in JAMA Internal Medicine found that long-term use of antidepressants with strong anticholinergic properties is associated with a 30% increased risk of dementia over a 10-year period. This risk persists even after the drug is discontinued. Symptoms may include short-term memory problems, difficulty concentrating, daytime sleepiness, and general slowness of thinking. These effects can be particularly problematic for older adults who are already more susceptible to drug side effects. There are more modern alternatives with a better safety profile for cognitive function, such as selective serotonin reuptake inhibitors, SSRIs, or serotonin norepinephrine reuptake inhibitors, SNRIs. The choice of medication should always be discussed with your doctor, weighing the risks and benefits. Crucial warning: never stop taking any prescribed medication abruptly without consulting your doctor. Stopping antidepressants suddenly can cause severe withdrawal symptoms. Overactive bladder is a common condition that affects millions of people, especially as they age. Medications like oxybutynin are often prescribed to relieve symptoms, but at what cost to the mind? Oxybutynin is another drug with potent anticholinergic effects. It works by relaxing the bladder muscles, but it is non-selective and also affects acetylcholine receptors in the brain. This blockade can have direct consequences on cognitive function. A study in the British Medical Journal found that the use of anticholinergic drugs for overactive bladder was associated with a 20% increased risk of cognitive decline over a 5-year period. The effect was dose-dependent, meaning that higher doses carried a greater risk. Warning symptoms include difficulty remembering appointments, problems with spatial navigation, getting lost in familiar places, and a general decrease in information processing speed. These signs can be easily overlooked or attributed to age. Safer alternatives include medications with a lower anticholinergic profile, such as mirabegron, or non-pharmacological approaches, such as bladder retraining, pelvic floor exercises, and lifestyle modifications. Always discuss your options with your urologist or primary care physician. Crucial warning: never stop taking prescribed medications abruptly without consulting your doctor. Managing overactive bladder is important for your quality of life. Benzodiazepines, such as alprazolam, Xanax, or diazepam, Valium, are widely prescribed for anxiety, insomnia, and muscle spasms. While they may offer immediate relief, their long-term use is associated with serious cognitive risks. These drugs work by enhancing the effect of the neurotransmitter GABA, which has a sedative effect on the central nervous system. While this can reduce anxiety, it can also suppress the brain activity needed for memory formation and consolidation. A meta-analysis published in the BMJ concluded that benzodiazepine used for more than 3 months was associated with a 51% increased risk of dementia compared to non-users. The risk was greater for older adults and those taking higher doses. Warning symptoms include anterograde amnesia, difficulty forming new memories after taking the drug, confusion, psychomotor slowing, and difficulty paying attention. These effects may be particularly noticeable immediately after taking the drug. Safer alternatives for anxiety and insomnia include cognitive behavioral therapy, relaxation techniques, mindfulness, and in some cases other types of anxiolytic or antidepressant medications with a better cognitive safety profile. Gradual reduction of benzodiazepines should always be supervised by a physician. Crucial warning: never stop taking prescribed medications abruptly without consulting your doctor. Abruptly stopping benzodiazepines can cause serious and dangerous withdrawal symptoms. Similar to diphenhydramine, first-generation antihistamines, such as chlorpheniramine, often found in cold and allergy medications, are another group of over-the-counter medications that can negatively impact brain function. These antihistamines easily cross the blood-brain barrier and act as anticholinergics in the brain. They block histamine and acetylcholine receptors, causing drowsiness and impairing higher cognitive functions. A study published in the Journal of the American Geriatric Society showed that regular use of antihistamines with strong anticholinergic properties was associated with a 15% increased risk of cognitive decline over a 2-year period. This risk was cumulative with other anticholinergic drugs. Alarm symptoms include excessive drowsiness, difficulty maintaining attention, memory problems, and a general feeling of grogginess. These effects can be particularly pronounced in older adults who metabolize drugs more slowly. For allergies, it's best to opt for second-generation antihistamines, such as loratadine, cetirizine, or fexofenadine, which have a lower blood-brain barrier cross-infection ability and therefore fewer cognitive side effects. Consult your pharmacist or doctor for the most appropriate choice. Crucial warning: never abruptly stop taking any prescribed medication without consulting your doctor. Be sure to carefully read over-the-counter medication labels to identify the active ingredients. Some medications used to treat Parkinson's disease symptoms, especially older ones like trihexyphenidyl, can significantly impact cognition. These medications are often used to control tremors and rigidity. Trihexyphenidyl is a potent anticholinergic. Although it is effective in reducing the motor symptoms of Parkinson's disease, its effect on the brain's cholinergic system can worsen cognitive function, especially in already vulnerable patients. A study published in Neurology found that Parkinson's patients taking anticholinergic drugs had a significantly higher risk of developing dementia than those who did not. The increased risk was estimated at around 25 to 30%. Warning symptoms include confusion, hallucinations, memory problems, and disorientation. These effects can be particularly difficult to distinguish from the symptoms of Parkinson's disease itself, making diagnosis more complex. Alternatives for managing Parkinson's disease include newer medications with a more favorable cognitive profile, such as dopamine agonists or levodopa. Managing Parkinson's disease is complex and requires close collaboration with a neurologist to balance control of motor symptoms with protection of cognitive function. Crucial warning: never stop taking prescribed medications abruptly without consulting your doctor. Managing Parkinson's disease is delicate and requires constant medical supervision. Not only medications, but also our eating habits can be a silent enemy of the brain. A diet consistently high in refined sugars and ultra-processed foods is a significant risk factor for cognitive decline. Refined sugars and simple carbohydrates cause rapid spikes in blood glucose, which can lead to insulin resistance and chronic inflammation. This inflammation damages blood vessels and neurons, compromising their function and survival. The brain is an energy-intensive organ, and its health is closely linked to glycemic stability. A longitudinal study published in Alzheimer's and Dementia showed that people with a high intake of refined sugars had a 40% increased risk of dementia compared to those on a low-sugar diet. This effect was independent of other risk factors, such as body weight. Warning symptoms include difficulty concentrating, brain fog after meals, short-term memory problems, and a general feeling of mental fatigue. These signs can be interpreted as simple tiredness or stress, but they are often linked to metabolic imbalances. The solution is a balanced diet, rich in whole foods, vegetables, fruits, lean proteins, and healthy fats. The Mediterranean diet is an excellent model, proven to support brain health. Drastically reducing added sugars, sugary drinks, and ultra-processed foods is a crucial step. Crucial warning: you don't have to completely eliminate sugar, but it's essential to consume it in moderation and choose natural sources. Small changes can lead to big benefits. Sleep is not a luxury, but a vital necessity for brain health. Chronic lack of quality sleep is an often overlooked risk factor for cognitive decline and dementia. During deep sleep, the brain activates the glymphatic system, a kind of cleaning system that removes toxins and waste products, including the beta-amyloid protein associated with Alzheimer's. Sleep deprivation impedes this essential cleansing, allowing harmful substances to accumulate. Research published in Nature Communications found that sleeping less than 6 hours a night in middle age is associated with a 30% increased risk of dementia in later life. This study followed thousands of participants for decades, providing robust evidence. Warning symptoms include difficulty concentrating, irritability, memory problems, slow thinking, and a general feeling of being unrested even after sleeping. These signs can easily be attributed to stress or age, but they're often a sign of poor sleep hygiene. To improve sleep, it's essential to establish a regular routine, create a comfortable dark sleep environment, avoid caffeine and alcohol before bedtime, and limit exposure to bright screens in the evening. If sleep problems persist, consult a doctor to rule out disorders such as sleep apnea. Crucial warning: don't underestimate the importance of sleep. It's a fundamental pillar of brain and body health. Risk factor number 1 is not a single factor, but the cumulative and often hidden effect of taking multiple medications that share the same mechanism of action: anticholinergic polypharmacy. Many medications, even when prescribed for different conditions, can have anticholinergic effects. When two or more drugs with anticholinergic properties are taken simultaneously, even at individually considered safe doses, their effects are additive. This anticholinergic load can reach levels that are toxic to the brain, significantly blocking acetylcholine and severely impairing cognitive function. A landmark study published in JAMA Internal Medicine demonstrated that a high anticholinergic load is associated with a 120% increased risk of dementia over a 10-year period. This risk is dramatically higher than using either drug alone and highlights the dangers of combining them. Warning symptoms are often severe and may include acute confusion, delirium, hallucinations, severe memory loss, and disorientation. These episodes may be mistaken for rapidly worsening dementia or a stroke, but they are actually an adverse reaction to medications. The solution is a comprehensive medication review by a trained doctor or pharmacist. This process evaluates all medications taken, including over-the-counter medications and supplements, to identify and reduce the anticholinergic burden. Often, problematic medications can be replaced with safer alternatives or doses can be reduced. Crucial warning: never attempt to change your medication regimen on your own. Managing polypharmacy requires close collaboration with qualified healthcare professionals. Despite the severity of these factors, there is a fundamental message of hope. The damage induced by many of these factors is often reversible, or at least mitigated, if the burden is removed or reduced. Many older adults who have reduced their anticholinergic burden or improved their sleep and eating habits have regained clarity, energy, and improved cognitive function within weeks or months. The brain has an extraordinary capacity for recovery, but it needs your help. Don't accept cognitive decline as an inevitable part of aging. Act now to protect your mind. Your brain health is too precious to be left to chance. We urge you to take specific and urgent action. Ask your doctor or pharmacist for a complete medication review. This process is essential for calculating your cumulative anticholinergic load and identifying any medications or combinations that could put you at risk. Be proactive and carry a list of all medications, supplements, and over-the-counter products you take. Don't wait until symptoms become severe. Prevention and early intervention are the most powerful weapons we have. Share this video with your loved ones and let us know in the comments what steps you intend to take to protect your mind. Your experience can inspire and help others. Together, we can build a brighter and healthier future for everyone. Subscribe to our channel. Daily hacks and practical tips to help you live your best life after 60.